Now we'll talk about another inherited disease condition that is kind of like linked to production of polyps in the gastrointestinal tract. This is what is known as a familial adenomatous polyposis. Okay, so once you hear polyposis, of course there's plenty polyps associated with it. Okay, so for the FAP, that's how they usually used to call it. You can see an intestine having FAPs, polyps all through. Okay, so we said that it's rare, okay, but it's an inherited condition, and the gene affected is a gene known as the APC gene. So it will lead to the development of hundreds to thousands of polyps in the colon and rectum. Can you see these polyps? So many you can't even count. Okay, so inheritance is usually inherited in autosomal dominant condition. So each child of an affected parent has a 50 chance of inheriting the mutation. So there's mutation in the APC gene. Okay, now this is a gene that actually regulates cell growth and division. So onset, polyps usually begin forming in adolescence or early adulthood. Okay, so often they even start forming before 35 years, right? So adenomatous polyps carpet, that means what? They are all around the colon and the rectum. They can also appear in the stomach and the duodenum. So there's risks of this condition progressing into what is known as a colorectal cancer. Okay, colorectal cancer. All right, so this is how it will look like on endoscopy. It's how it will look like on endoscopy. So diagnosis, you do things like colonoscopy, then you also do genetic testing to see that there's mutations in the APC gene. Then for treatment, they can actually remove the colon if there's a risk of cancer or if there's cancer already. Okay, then regularly they survey the stomach and the duodenum with endoscopy. Then they just keep monitoring the person. Okay, that's if it has not actually progressed to cancer.